Thank you for covering the press conferences every day. I wanted to come to the Mahoning Valley today to talk directly to the people of the valley. And the reason I wanted to do that is because yesterday, as you may have seen in our press conference, we now have Mahoning, Trumbull, as well as Portage County that are all red. And I really wanted to come and explain this to the people of the valley, what it means, and really where we are. First of all, the people of Mahoning Valley have done a very good job through the 7 months of this pandemic. By and large, have kept the incidence of the cases down, and so we're very happy about that, and I congratulate everyone in the valley. I also want to thank the health departments. I want to thank our schools, K through 12. I think they're doing a very good job. Also want to thank Youngstown State. This is a trying time for everyone, but all the institutions in the Mahoning Valley have hung in there. The people who are working there are doing a phenomenal job, and I just want to say that really before we get started, and that's part of my message and one of the reasons I wanted to be here today. I want to talk a little bit about the color code and what going red actually means. And I think we should look at this, the people of any county where it is red, as just a warning. Some of the indicators, we have seven separate indicators. The idea is to be measuring a lot of different things, and what we have, it really takes a comprehensive look at what is going on in the different counties. We really have two ways of looking at this. It's the 7 indicators, and then we also look at how many cases per 100,000 population in the last 2 weeks. So everything really is based on the last 2 weeks. The 4 indicators that caused Trumbull and Mahoning County to go red this week are the following. And again, this is based on the last 2 weeks. More than 50 cases per 100,000 residents. Both of them are over that. Second, new cases tending up over at least a 5-day period of time. Third, not that many cases in the congregate settings. So in other words, this is to indicate that this is out really more in the community. And the 4th indicator, sustained increase in emergency department visits for COVID-like symptoms. Again, that is an early warning sign. Having 4 of those, these 2 counties are now red. And let me give you the numbers, and the numbers obviously are going to change every single day. So what the health departments may tell you, they may measure it at different days, but this is what our numbers as being reported from local health departments show. In the last 2 weeks, Mahoning County, we'll start with Mahoning, cases per 100,000, they're at 93. So the high incidence, what the CDC says is high incidence, is 100, just to give you an idea. Mahoning County, 213 cases, 34 people hospitalized, new people going into the hospital during that period of time. Trumbull County, their rate is 54.1 cases per 100,000. 107 actual cases in the last 2 weeks, 7 people going into the hospital. Columbiana County is at 52 per 100,000. Again, the rate, and they are actual cases, 53, and hospitalizations, 7. Hospitalizations, 7. We'll wait till he gets out of here. During the last 2 weeks, the total deaths in the valley that have been reported to us, sometimes these take a few days to be reported, were 5. And so we should look at this as a kind of a continuum process where someone is exposed, then they have symptoms, then they may get sick, and then of course at some point those who get really sick end up in a hospital. Portage County, when you look at the map, you got 3 counties together: Trumbull, Columbiana, Portage. Portage actually had 157 cases. They're at 96 per 100,000, just to kind of give you an indicator there. Now, why is this happening? This is really why I'm here, is to talk to the people of the Mahoning Valley. Done a good job so far, but the red indicates that should be a warning. It's a warning sign that things are starting to go the wrong way on us. What is causing that? What we're seeing in the Mahoning Valley is the same thing, frankly, that we're seeing across the state of Ohio. And that is most of the new cases are coming from people just not being cautious, not wearing the mask, not having the mask when they're within 6 feet of people, going to larger events, and just really, frankly, letting their guard down. And that's really what is causing this. Parties, weddings, funerals, and I'll go into details in a moment. So let me talk about, first starting with Mahoning County. Red for the first time this week. Health department officials have told us they had multiple outbreaks, including one out-of-county wedding that had 18 associated cases, and those were spread out, not all in Mahoning County. The wedding now also has secondary cases associated with that. 2 separate funerals in Mahoning County have also seen cases associated with the funerals. There's also been outbreaks tied to a group home and outbreaks tied to a birthday party. These are just a few of the things that we're seeing. Health department officials also report and have asked me to make a direct request to the people of the valley to please help them. Help them when they're inquiring about what has happened. Help them with the reporting, because it's only through the tracing that we're able really to slow this down. Let me move to Trumbull County. Trumbull County increased from yellow to red, so it jumped 2 just this last week. The county was last red the week of August 20th. Local health department officials report an outbreak of 22 cases with a school sports team. The outbreak involves 11 players, 3 coaches, and it's expanded to 4 students not on the team and 4 parents. 1 coach sadly had to be hospitalized. School administrators have been working very closely with the health department. And again, let me just say, our schools are doing a good job. Our colleges are doing a good job. Health department is doing just a phenomenal job. The health department is assigning a nurse to work with the schools, but in Trumbull County, at least 1/3 of the school districts have a case there. There's also been widespread spread in families and throughout the community. Again, health departments in Trumbull County have asked me to make an appeal directly to the people of the county to help them with the tracing when that is necessary. We're also seeing some community events that are continuing to happen, which can lead to increased virus transmission. Youngstown Health Department, working with faith leaders in the Mahoning Valley, are organizing testing. Our National Guard is coming in to help with the testing. That will be on Thursdays, and I'm sure you probably already have more information about the specifics there. We're also seeing something across the state that we're very proud of, and that is we're seeing more manufacturing that are involved in making PPE, personal protection equipment. When we started into this pandemic, it was all coming, most of it coming out of China, and we had a real problem getting it. What we're seeing now in the state is we're going to make more of this right here in Ohio. We're going to make some of this in the Mahoning Valley. Hometown Pattern is going to start making face shields, and so we're very happy with that. We have a company not in the valley, but outside the valley, a few days ago announced that they're going to start making N95 masks. So we're very happy about that. So again, I'm here to really kind of explain exactly where we are, what's going on in the valley. The valley's done well. I'm optimistic, but this red is a real warning sign. We've got to buckle down. We've got to focus. We've got to do what we have to do. Our goal is to continue to keep the economy open, continue to keep schools open, continue to keep our colleges open, allow people to go about their lives. But the only way that is going to happen is if people wear the mask, wear the shields, keep the distance, wash their hands very, very frequently, and really not let the guard down. I think what we're really seeing in not only in the Mahoning Valley but across the state is people letting their guard down. There's ways to safely go to funerals. There's ways to safely have weddings. There's ways to safely do about anything that we want to do. But if we're going to help our kids, keep our kids in school, have sports, and do all the things we want, it really depends on what's going on in the community. One of the big concerns about college students, high school students, grade school students, where the spread occurs there, is that they in turn infect other people who are older. And that really is where you start seeing the deaths. So the deaths are a very lagging indicator. It might take a 20-year-old getting infected who infects a 50-year-old who maybe infects a 70-year-old, and then they get sick, and then they go to the hospital, and then tragically we're still seeing deaths. And so that could take a long time. But the point is we got to get in front of this now. And so this is why I'm come to the Valley on this beautiful day, just to really make this appeal to the people of Mahoning Valley. We can do this. We're Ohioans. We're tough. But we got to hang in there. I'm more than happy to take any questions.
That school district that you mentioned, was that the Champion School District?
I don't have that. When I give the information, I try to give it out in a broad sense. Our local health departments usually ask me not to specify. If they want to specify, they can do that. I don't want to come into a community and point any fingers. The only reason I'm talking about these things is I think we learn from examples, and when you see examples occur, for me at least, it's a lot easier to understand why we're seeing the spread. And I just try to talk about that. I mean, yesterday I talked about a horrible case that was not here at all, not in the Mahoning Valley, but a case about a wedding, big wedding, didn't have social distancing, most people were not wearing masks, and we end up with a lot of people getting sick, and two of the grandfathers ended up dying. And that's just, it just breaks your heart to see that. Who else?
Governor DeWine, Caroline Collins here from 21 WFMJ News. It's nice to meet you.
Nice to see you.
Thank you for making a stop here.
Thank you.
Are you anticipating any sort of other shutdown?
Let's let him get out. We'll let him take off, land, whatever he's doing. What happens if you have a press conference at the airport, right? What do you expect? What do I expect? All right, let's try it again. I'm sorry.
You know, with these big gatherings being one of the problems that you're talking about is people not following the rules as they should, are you anticipating any more shutdowns or heavy restrictions as far as restaurants and large gatherings and sporting events? Would you shut those down again?
Well, the interesting thing is that when you analyze where most of the spread is, it's generally not in the classroom. It's generally not in the college classroom. is most of the time not in business. What it is people doing what they normally do in the way they normally do it. And what we're asking them to do is you can do most of the things you normally do, you just can't do them quite the same way. And you know, having that mask on is just absolutely essential. If we could get 85% of the people in this state to wear a mask every time they were out, where they couldn't social distance, we would knock this thing down. We really, really would. I am very concerned, frankly, about what I've seen in the last 10 days in Ohio. You know, our cases now are averaging, you know, 1,500 cases a day. That's up from 2 weeks ago when it was 1,000 cases a day. We're seeing our statewide positivity go up. We were down to about 2.5, 2.6, which is pretty darn good. We are now trending, I think yesterday was 3.8, 3.9. And so that's just going, all of these numbers, every single number is going the wrong way. And we're also seeing, you know, more people going into the hospital. And within the last week, we've started to see, 10 days or so, we've seen an uptick in the age. So for a while, you know, if you go back July, August, September maybe, you were seeing, you know, over half of the cases under 30 years of age. Today, that is edging up, and that's worrisome because we know the older people are, the more dangerous it is. And so what we think we're seeing is this rebound effect. Kid gets it, maybe has symptoms for a few days. Some get real sick, but most don't, and then that's passed on. Or let's say a child comes home from high school and doesn't have any symptoms, but they really have it. And we can't measure it, we're not testing there. So that family gets infected. We think that that's now what we're starting to see, which is what is really scary, which is really scary about this whole thing. So I'm not here, you know, we're not blowing a whistle and saying, hey, there's a big alarm going off. What we are saying is we got bad trends. Your county's gone red. That's a signal. We gotta get serious again. And I understand what's going on. Look, I'm sick of it too. No one wants to wear a mask. You know, Fran and I walk down most nights and see some of our grandkids, and we're seeing them from this distance. And we've got our mask on, and we're outside. So it's not exactly what we want. We've got two of our daughters going to have babies this late fall, winter. You know, we want to be able to hold them. We're not going to be able to hold them. So we're sick of it. But the goal is to get through this. We will get through this. We want to have as many people there coming out of this thing. You know, we've already are making plans for the vaccine when it comes out, how we're going to quickly get it out. We're going to take it out to the most vulnerable people first, people in our nursing homes, people in congregate care settings. Then, you know, right at the same time, we'll try to get over to the first responders, and then we'll fill in people. And that's going to take a while. But the plans are in works. The federal government is, you know, going down several different lines. They're making a lot of these, and as soon as they get approval, then we'll start out. So I don't know that the end is quite in sight yet, but we're going to get through this. But we could have a very rough winter. We could have a very, very rough winter, and I'm very concerned about that. Who else has a question? I would not call this a second wave. I don't think people will, the medical experts will say it's a second wave. I think what we have is people letting their guard down more. It's getting colder, and as it gets colder, people are inside more. And when people are inside more, that's a problem because it spreads more. And that's why, you know, we worry about the fall. We worry about the winter, what we're coming into. We also worry about the flu. And again, I would just ask everyone, these flu shots are generally available now. You can get them at your local pharmacy, get them at your local doctor. You know, get them now. Now's the time to get them. Fran and I have already had ours, and we would just, ask people to get those. What you don't want is a situation where, end up with the flu and you end up with COVID at the same time. That's just not, that's not a happy thought. And so we need to take care of business. Who else?
What happens when you see a huge increase in the winter? Do you reevaluate what steps need to be taken?
I reevaluate this every day. So, I get a 44-page report that comes out about 6 a.m. and I look at the numbers from the previous day. I look at hospital admissions. I look at people showing up in emergency rooms, people showing up in doctors' offices. So I evaluate this thing every single day, and our health people evaluate it every single day. So what I do know is, people always ask me, are you going to have to shut stuff down? And I know that if we can get mask compliance up significantly, that question just won't come up. I'm confident of that. So I don't think we're in a second wave. I think we're starting to be, it's getting colder, people are inside more, and I think people are tired and they're letting their guard down. And so, I would simply say that we're Ohioans, we're tough, let's hang in there, we can do this, and we could go about our lives. If we want our kids in school, if we really want our kids in school, if we want them playing sports, if we want to be able to bring our economy back, if we want people to be able to work, all of these things depend on, will we do a few basic things? Will we wear a mask? Will we keep a distance? Will we avoid big gatherings of people? Even if they're our friends, even if they're our family, these are things, if we can do them, it'll get us to when we can start getting the vaccines and then get enough people vaccinated. We're not going to be able to stop wearing the mask when we first start vaccinating people. And then we're going to have to see how it goes. But we can get through this, and I'm very optimistic about it. Anybody else?
There's going to be